Well, it's rolling, so the numbers are much higher now. So we're 10 days into this first outbreak of COVID ever in the Marshall Islands, and we're up close to 5,000 now. Most of those are in the capital, Madura, which has a population of about 22,000. So we're talking about a quarter of the population already, positive, and actually those are only the people who've come in to get tested. So presumably it's many more, much higher percentage. And the fact is, this Omicron BA.5 just spreads like wildfire. I mean, it's just unbelievable. And it's so far, I mean, the number of hospitalizations and deaths have been kind of relatively low, but I think the deaths and serious illness may pick up now that we're getting more deeper into the outbreak.
And as you say, in the capital over the past week or so, cases have gone from just a handful to thousands. What could explain this very sudden jump in numbers? Could it be to do with the testing rates?
Well, I think it's just how COVID is. It just spreads. And in a Pacific Island context where you have large households and there's no ability to isolate people, if one person gets COVID in a household of 10, pretty much everybody in the household is going to get it. And it's just how it goes here. I mean, it's just like when we get an outbreak of flu, I mean, thousands of people get flu because everybody lives so closely together. It's just how it goes. And the case count went, I think the first day was something like 6 cases, and in like 4 days, they were up to 1,000 a day. But of course, there's active testing. I mean, they've got all these community test sites set up where they're getting people in to try to do treatment and help people out. And one of the really great things about what's going on is because we're connected with the U.S. Centers for Disease Control, we're loaded with the therapeutic drugs like Paxlovid. So they've already given out 2,000 doses of Paxlovid to people who have symptoms of COVID, which must be limiting the number of hospitalizations. You know, the problem is more getting the really seriously ill people to get them into hospital and be able to treat them.
And what measures are currently in place to prevent the spread of COVID-19? Are people wearing masks? How many are vaccinated?
Vaccination rate here is relatively high. I mean, it's listed as like 75% of the population, but that's based on a previous census, which is, we have a new census, and the numbers are quite lower. So we estimate it's probably above 85%, so not bad for vaccination rate. Yeah, everybody pretty much is wearing masks now. The only real thing that's been done is that the schools have been directed to close. Normally the school year starts this month. So all the schools have closed for a couple of months. And I think part of that is just to slow the spread a bit, but I don't think anybody in this country thinks that like a lockdown would do anything to slow down the spread. So we won't have lockdowns or anything like that. That's futile. So essentially, it's mask wearing and trying to get people in to use the therapeutic drugs if they've got symptoms.
And what rules apply to people travelling in and out of the Marshall Islands? Do they have to quarantine? What are the restrictions there?
Okay, so up to last week, the Marshall Islands had one of the most restrictive quarantine regimes in the world, and that's why it remained COVID-free for 2.5 years. In fact, I believe that the Marshall Islands and Tuvalu last week were the only 2 countries still without COVID. I mean, there's other islands like Tokelau and whatnot that don't have it, but countries, I think so now Tuvalu is the last man standing, but it was because the Marshall Islands has had a 2-week quarantine rule on inbound with managed quarantine, a lot of testing, and they've managed to keep it out, but they've been cutting back on the quarantine slowly and overloading their repatriation numbers in these quarantine facilities. And probably it just, something just slipped out. And this COVID variant is very transmissible, and somehow it got out the door. And so now, since Monday a week ago, but obviously it was circulating in the community a few days before it was positively identified. But since August 8, we've had community transmission.
And Giff, how prepared is Marshall Islands for a significant outbreak of COVID?
Well, generally speaking, I'd say they're pretty well prepared because they've got the U.S. CDC, they've been working with them for 2.5 years. And just yesterday, a big team of CDC, WHO, UNICEF, and other Taiwan medical professionals flew in to support the ongoing efforts on this. So they've been, boosted by having a surge support team like that come in. They've got all this Paxlovid and a bunch of other drugs. So when you think about, a country out in the middle of no place, because of the U.S. connection, we're pretty well placed to be fighting this off. And the fact that we've had 2.5 years to watch it play out in other places, I mean, pretty much everybody knew the first week was going to be chaos, and it was. But by the last weekend, they got control of their community sites where they're doing the test and treat work. They had a lot of volunteers joined in, helped to smooth the management, and things have really now things are moving pretty well in the community. A lot of places for people to access testing and treatment. Maybe they've got maybe half a dozen sites set up out, not in the hospital, but out around the island. And now they're sending people out to the outer islands because unfortunately it's already spread to these remote islands that have very little in the way of health care. So that's a big worry for those islands because they have basically nothing. So they're trying to get, the Paxlovid and some of these therapeutic drugs out to the remote islands so that the health aides there can be providing them as needed.
And what assistance is the Marshall Islands getting internationally to cope with the pandemic, not only in the short term, but also with regards to long-term challenges it faces?
Well, the Marshall Islands relationship with the U.S. would be the key one because that brings the Centers for Disease Control and other agencies into play. They've been just fabulously engaged in supporting, providing vaccines from from right when they were released in 2020 and all kinds of other things. Taiwan also is a very major player here because the Marshall Islands is one of the few countries that maintain diplomatic ties with the Taiwanese, and they've really come in to help out and do lots of things. And of course the WHO, and I mean there's lots of players, but the CDC and the Taiwanese are the ones that have really backed up the Marshall Islands. And the fact that we've been able to have vaccines for the last 1.5 years has really allowed the country to get the vaccine rate up pretty high, even though obviously you can never be perfect. But I'd say they're probably well over 85%, which is a pretty decent rate.
Giff Johnson, thank you and stay well.
Sure. Happy to help.